is Tamara Holness. I'm going to be performing pass. First one I'm going to be doing is the intramuscular, so I'm going to start now. So the first thing I'm going to do, I have my MAR, right, which is a medication administration record. I'm looking at the patient's name, date of birth, then I'm going to look at what is ordered and compare it to what I have. Excuse my dog. Okay, so the first thing I'm going to do, right, is look, the doctor has ordered Practi haloperidol 2 milligrams intramuscularly, right? I'm going to perform hand hygiene before I even touch the medication cap. Put this back on here because I tried to practice first. All right, I'm going to hand hygiene, pick up the medication, and I'm going to look at it. So, it's Practi haloperidol 2 milligrams. It was 5 milligrams, but I'm going to drop 2 milligrams. And this is for control of agitation. The time that this needs to be administered is now. Okay. I looked at it. Okay. So this time I did hand sanitizing. I'm going to use an alcohol swab and I'm going to wipe the top of the medication vial. Okay. I'm going to take my needle and syringe. I'm going to draw up. I'm going to draw up what the doctor ordered of air. So 2 milligrams of air. Right? Take the cap off and I'm going to insert it right in the center of the vial. I'm pushing air inside because air is able for you to drop the medication easier. So now that medication is being drawn up. Right, it's supposed to be 2 milligrams, which is what I'm going to do. 2 milligrams, okay. Flowing. Alright, so at this point, I'm at 2 milligrams right here. So here I'm just going to knock out the bubbles out of the syringe. Right, so there's no bubbles in the syringe. Flip it back down. Take my syringe out. Then I'm just going to recap my needle. So at this point, I'm going to use a tape and I'm going to label the patient. I'm going to put the patient's name, the medication, the dose of the medication, and I'm going to tape it onto the syringe. So that way when I go into the patient's room, I know that I picked up the right vial for the right patient and the right dose. Okay? So again, I'll double check now to make sure. So I have 2 milligrams of Practi haloperidol, right? And it's for control of agitation. The time to do it is now. This is for Miss Millie Lawson. And from what I can see, she does not have any allergies. I will ask her again when I get into the room just to make sure. Okay. So this is my patient. I didn't have an orange, so I'm going to use I didn't have an orange or grapefruit, so I'm going to use the avocado. Right? They don't look points for that. But anyway, so this is my patient. But I'm going to knock on the door. And I'm saying, knock, knock. Hi, Miss Millie. My name is Tamara. I'm one of the nurses here. Can you give me your name and date of birth, please? She gives me her name and her date of birth. It matches my MAR, her name, her date of birth. Correct. Okay, I'm going to be at, the doctor ordered Practi haloperidol for you. He's giving it to you because you're a little agitated. Is that okay? Yes. She verbalizes yes. So this medication is going to be given to you. Excuse me. Look at this paper. The medication is going to be given to you through the ventral gluteal site, which is basically your behind, but I'm going to need you to go on whichever side is more comfortable for you. So she chooses her side. Okay. This is the patient. So the first thing I'm going to do again, I'm going to practice hand hygiene again. Right? I made sure it was the right patient, right time. I'm giving the 5 rights. So it was the right patient, right time, right documentation, right medication, right dose, and right site. So those are the 3 sites, and I checked that I made sure, right? So this is my labeled medication. I'm going to go to her. So basically, when you're doing this type of injection, what you're going to do is you're going to have the patient, this is the patient's side. You're looking for, you're giving it to the patient. I'm forgetting where the correct wording. But anyway, my three hands are here. And my thumb is here, so I'm gonna give it to the patient right in the center of my four hands and my fifth digit. Right. Hold up the skin taut. But before I do that, I'm going to lean from inside out. Right. Then I'm gonna hold the thigh, or the buttocks area, the ventrogluteal area. Take my syringe, right, and we're doing it at a 90-degree angle because it's intramuscular, meaning a 90-degree angle. I wouldn't do this like this. It would be covered. I'm just showing you. I will inject it. Then I will press down. I don't want to press down all the way because I don't want to eat this avocado. So, so I will press down. The medication would be administered. I will remove it. Remove the thing, the medication, and I will put it in the sharps container. Right? Okay, put it in the sharps container. After that, I'm going to clean the site. Right? Then I'm going to check on the patient. Before I wiped it, I forgot that I actually let it dry for a little bit. Before I injected, I let the alcohol dry in the skin first. So again, I'm going to see if she's okay. Miss Millie, are you okay? Was that okay? She verbalizes it was okay. She's well. I also, before giving her the medication, I will educate her on the side effects of the medication. Prior to, I also would ask her again about her allergies, if she has any allergies. And I'm just going through the steps in my head, and that's it. Then again, I will perform hand hygiene, make sure that she's comfortable, and that is my IM injection video.